The word dizziness can be used in several different situations. There's multiple even types of dizziness. If a patient would come in with a problem of dizziness, our first step is a pretty detailed case history. With dizziness, case history, hearing symptoms from the patient is probably one of the most important parts of the evaluation. Probably one of the most common type of dizziness, it's what's called a positional dizziness or positional vertigo. You'll hear the acronym BPPV, and what that means is benign positional proximal vertigo. That's the one that patients often hear about getting your rocks knocked loose. Pretty common. That's a real quick spinning sensation, a real quick dizziness. Probably the good thing about that type of dizziness is that it's pretty easy to treat. 98% of people have complete resolution of dizziness after therapy treatments. So I suppose if there was a type of dizziness to have, that's probably what you would want, because hopefully we can kind of get rid of that. There are also dizzinesses that have to do with the nerve of your inner ear. You can have inflammation or even a viral type of infection in your inner ear that basically causes the nerve connection to your brain to kind of go haywire. That's another type of ear-related dizziness. There can be dizziness related to blood pressure problems. There are some medications that cause some pretty severe dizziness. Even anxiety and that type of stuff also can cause a form of dizziness. Using medication to stop dizziness is simply just kind of taking the edge off of a symptom. It's not going to cure anything. Medication can help you stop feeling dizzy, but it's not solving a problem at all. Typically the best form of treatment for a dizziness problem, if it is ear-related, is the physical therapy. Overall, what physical therapy and vestibular process have in common, what they're trying to work for, is retraining your brain. Retraining your brain that, something isn't working the way that it used to. We have to make your brain figure out how to stay balanced if something is a little bit different than it used to be. It can be a long process sometimes, depending on the person, depending on how quick your brain can kind of react to things and be able to compensate for something that's different than what it used to be. Some people have a couple therapy sessions and they're good to go. For some people, it takes a couple more. One of the biggest benefits of getting a dizziness evaluation in this clinic is that audiologists work directly with a physician, with an ENT doctor, which is great as an audiologist to do the diagnostic work, to do the evaluation, to figure out what's wrong, and essentially 10 minutes later you'll see a physician to get treatment. So it's a very quick step, which is terrific.